This is Tom Bernanke, and today I'm talking about osteoporosis. This is something I see all the time. Weak joints, weak ligaments, stress fractures in the foot, stress fractures in the ankle. They happen all the time. It's said that 1 out of 3 older people will develop a stress fracture or fracture due to osteoporosis. It's getting worse over time. Our diets are getting diluted. There's some huge mistakes people are making in regards to osteoporosis. We're gonna go over what it is, the tests, all the best home treatments, all the best supplements, all the things you need to be doing, and all the mistakes you're making. So stick around to the end and make sure you kick osteoporosis in the butt. Osteoporosis is a medical condition characterized by the weakening of the bones. Osteoporosis leads to less bone density and a higher rate of fractures. The bones are made up of 75% minerals: calcium, calcium phosphate, magnesium, and about 25% collagen. Collagen is the soft, wavy, flexible part. Minerals make up 75%. That's that ceramic, hard, rock-like part. At age 25, we reach our peak bone density and then it drops off a cliff. It's said that people over 65 or postmenopausal women, about 1/4 develop osteoporosis. On the left-hand side is your skeletal mass in grams. You can see the male is about 1,500 at about age 25, 30. The female is on average about 1,200 grams, but you could see at age 50, 60, 70, it dramatically declines, especially postmenopausal females over males. This is a huge drop in bone mass. It has to be prevented for a healthy life. According to recent statistics from the Osteoporosis Foundation, 1 in 3 women over the age of 50 and 1 in 5 men will experience osteoporotic fractures in their lifetime. 35 million people in the United States. In Canada, in 2020, they performed a study looking at the incidence of osteoporosis-related fractures in both men and women. The men are in green and women are in purple. Women are extremely higher. Look at that. Almost 50% incidence in the 80s, in the 90s. It gets even worse in the 90s. This is not something to brush off. Stress fractures and joint pain are a real problem. It's weak bones, weak joints, weak muscles. This leads to a ton of problems. And this is referred to as the silent disease because it progresses gradually without any signs until you develop significant bone problems that are very difficult to recover from. It is most common in the hip, spine, and wrists. Osteoporosis is usually asymptomatic until a fracture or joint pain develops, specifically lower back pain, wrist pain. I see it in the ankles, in the foot, stress fractures. If you have ball of the foot pain, heel pain, ankle pain, this could be an early stress fracture developing. Stress fractures in your spine can lead to loss of weight, back pain, hunched posture. Hip fractures can result in severe pain, immobility, the need for hip replacements. What's the causes of osteoporosis? The primary cause of osteoporosis is bone remodeling. So you have 3 types of cells. Fibroblasts make up the collagen, so that's 25% of our bone. That's very important. And I go over it in a study about a new supplement called Coact, which can supplement the collagen. But most of the treatments we're going to talk about focus on the mineral content as well. But essentially, you have cells called osteoblasts. I like to think about them as blasting new bone. Osteoclasts eat the bone and put calcium back into your bloodstream. So osteoblasts build it up, osteoclasts break it down. A lot of medications like bisphosphonates target osteoclasts, so they stop it from chewing down the bone. But what we want to do is we want to build it up naturally and stop it from breaking down naturally. The biggest risk factors for osteoporosis include aging, hormonal changes, specifically postmenopausal women. And some of the treatments are actually estrogen replacement for menopause, low body weight, smoking, excessive alcohol, poor diet, long-term use of steroid medication, and deficiencies, so not enough sunlight, vitamin D. In the north, the tricky part is from about November to about March, the sun is south. So you're not getting a lot of rays, especially in North America, in Europe, in Russia, northern China. And this is why I mentioned a lot of these illnesses like autoimmune illnesses, osteoporosis, the vitamin D deficiency symptoms, they're seen in a lot greater quantities in these areas above 35 degrees north and below 35 degrees south. But below 35 degrees south, there's not a whole lot of population in the world. And what kind of tests are there for osteoporosis? The most common one is called a DEXA scan or bone density testing. This is the most common one. It uses values that are reported as a T-score, so it compares healthy people of age to essentially someone with osteoporosis. There's also other ones called the fracture risk assessment. There's blood tests that can check calcium, vitamin D levels, magnesium levels. There's also other tests like bone marker tests. I don't really get into those. Maybe the DEXA scan. I work with a great endocrinology group that does this. And if you're in the Michigan area, come get checked out by your favorite foot doctor right here. And I can set you up with the endocrinologist as well for some of this testing. And what's osteoporosis versus osteopenia? Osteoporosis on the test is basically really bad bone loss. Osteopenia is just somewhat bad bone loss. So obviously there's more osteopenia. And that's just determined on the tests. Let's go over the treatment. I don't prescribe these myself, but I work with a great endocrinology team in our office. They can do hormone replacement therapy. So there's studies for estrogen replacement. There's tests with monoclonal antibodies. These can prevent bone resorption. These are newer ones, and in the New England Journal of Medicine, they go over these monoclonal antibodies. These are very effective. Again, I don't prescribe these, but I see this prescribed. Calcitonin. This could be used to relieve bone pain, and this could treat fracture pain. A randomized controlled trial was done in 2018 where calcitonin had some good results. Raloxifene, this is a estrogen receptor modulator, so for postmenopausal women, this could be very effective. This was performed in 1999. There's denosumab. This is an antibody that inhibits fractures, so antibodies work really well. There's anabolic drugs. There's steroids that can essentially be used to build up the bone. These are the good steroids, not the glucocorticoids. And then the most common ones are bisphosphonates. Bisphosphonates like alendronate and risendronate, these can reduce bone reabsorption. They don't make the osteoblasts work harder, they make the osteoclasts work less hard. The bone breakdown cells don't work as well. These are not perfect medications. Studies show that this could cause a lot of side effects. Bisphosphonates long-term do have a lot of side effects. We're gonna go over more natural treatments. We're not gonna focus on the medications. We're gonna do a countdown. Number 1, you want to eat proper nutrition and supplements. Specifically, the single most supplement and nutritional component is vitamin D. I could talk about this for half an hour, and I do. I talk about the vitamin D toxicity, the best vitamin D foods, the big mistake people are making with vitamin D. It is about 78% deficient. This is a study in 2023 that looked over the world with 8 million people. It's just as high as ever, even with how popular vitamin D is. Almost no one is getting enough vitamin D. We go over the risks, what people are doing wrong. Can we get enough from the sun? This is gonna blow your mind, whether this is true or not. Can we get enough from diet, from the foods we eat? The results are gonna surprise you. So I highly recommend you watch that video. The recommended amounts are probably a lot lower than studies show we need. Vitamin D is probably the single most important thing. And vitamin D essentially takes calcium and puts it into your bloodstream. It helps your body retain it and prevent it from leaving the body. 2 things control your bone buildup. Your parathyroid gland, which releases parathyroid hormone, that makes the bones take up more calcium. And parathyroid hormone also creates vitamin D. So you have to have sufficient vitamin D. Both work on the intestines to take up and keep more calcium. If you have more calcium, more parathyroid hormone, more vitamin D, cells called osteoblasts, you can see them working here, they lay down more bone, they build more bone. If you don't have that balance, then cells called osteoclasts eat up the bone, chew it up, and you develop osteoporosis over time. It's been said that if you take calcium supplements, but not enough vitamin D, your calcium will just leave your body. Your body will not signal to retain it. But if you're getting enough vitamin D, you hardly need any calcium at all, and it will retain in your blood and go into your bone. Studies show that calcium and vitamin D together significantly reduce risks. This has been studied over a ton of studies. This is undeniable at this point. Probably want to supplement. If you're not getting enough sunlight, if you're not getting it, if you're not in a warm location where you can get like half an hour or more of sunlight per day, you want to consider supplements. You can ingest vitamin D2 or D3, but we're focusing on sunlight here. So specifically UVB rays in the wavelength of 280 to 320 convert 7-dihydrocholesterol in a non-enzymatic. So an enzyme is not used. It's very unique. It's a thermal degradation that turns 7-dihydrocholesterol into vitamin D3. Crazy. Here's the best vitamin D supplements. What should you take, vitamin D2 or vitamin D3? There are two forms. D2 is essentially the plant form. D3 is considered to be the preferred form because this is the active form in the body. A study published in the American Journal of Clinical Nutrition compared vitamin D2, vitamin D3. The study found that D3 was much more effective in increasing our vitamin D levels. Sometimes doctors will prescribe you the multiple 100,000 unit injection. So you could get like a 500,000 unit injection, but this is rare. You don't need to necessarily do this. Vitamin D supplements usually come in tablets, soft gels. You can take the drops. Usually the drops or cod liver oil or potentially the medium chain fatty acid tablets are the way to go. It is actually possible to use a sun lamp. Now there's a lot of brands out there and I looked this up. The studies aren't very conclusive. That means nobody really paid to do the studies, how much you need for how long, but they recommend, 5 minutes, 3 to 4 times a week. That's all you need to convert your skin to your level, to your kidneys and get your vitamin D. So that basically means your 7-dihydrocholesterol level can be converted by 5 minutes with this lamp to pre-vitamin D3 to get your normal levels. Now, there's no real studies verifying this, so tell me what you think. They are about $600 or more, so they're not the cheapest thing in the world. What's the dosage? The dosage in America is usually about 800 units to about 2,000 units, but so many studies recommend higher amounts. I personally take about 5,000 to 10,000 units. I combine it with vitamin K2, with magnesium, with omega-3 fatty acids. Very important to check that down below. And quality in the brand. Look for reputable brands. Check the reviews. Check if there's certifications from the USP or Consumer Lab. The reality is consumers have lost some faith in some of these large government organizations. Want to read the reviews too. That might be a better way to go. I put some of my favorites down below. And the trick is really, no matter what supplement you're taking, you could have a bad batch. There was a lawsuit where one guy was taking supplements that were mislabeled and he essentially took 1 million units per day for 2 months. He developed a toxicity. When he stopped taking the pills, it went back to normal. It's almost like nothing went wrong for him. That's one case. I don't recommend taking 1 million units. That's crazy. Stick to the recommended ranges. How do you get that 1.5 grams of calcium? The easiest way to get it is dairy products, so milk. 1 cup or about 250 milliliters of cow's milk contains about 300 milligrams of calcium. 2 to 3 cups, right there, you've already got 1,000 milligrams. Yogurt, a typical plain yogurt in a cup is about 300 to 400 milligrams of calcium. Cheese, 1 slice of cheese, about 28 grams, contains about 200 to 250 milligrams of calcium. Essentially, drink 1 glass of milk, 1 cheese slice, and 1 yogurt, and you're close to being good. This list shows specific values, but bok choy, almonds, okra, mustard greens, goat cheese, broccoli. Natto is a good one. We're going to talk about vitamin K later, but natto gives you both calcium and vitamin K2. That's a great option. For vegans, you got collard greens, some sesame seeds, some kidney beans, but for people who can eat meat, sardines, cheese, you have yogurt, you have dairy. Kale's another good vegan option. Whey protein, surprisingly #1, but 3 scoops is a lot. That's a lot for anybody. You'll probably get some gas after that. And milk is really good too. If you're a vegan or a vegetarian, kale gives you about 200 milligrams of calcium per cup. Collard greens gives you about 200 to 300 milligrams. Spinach is a great source. If you're a vegan, don't worry. Look at broccoli has it. Oranges have it. Almonds have it. I love almonds, but they're a guilty pleasure, too addicting. Rhubarb,
Bok choy, I love bok choy, very underrated vegetable. Soybeans can be good. Kale, look at how much is in kale right there. A couple cups of kale should take care of your day. Dried figs, that's a great snack. Turnip greens, black-eyed beans, collard greens. You know, I'm not familiar with blackstrap molasses, but it has the most in it. I'd stick with the other ones if it was me personally.
And many foods now are fortified with calcium, such as orange juice, almond milk, soy milk, breakfast cereals. A lot of breakfast foods. Tofu has a lot of calcium in it, 200 to 300 milligrams of calcium per 4-ounce serving. Canned sardines. So fish have everything. Fish have vitamin D, they have calcium, they have omega-3 fatty acids. That's a great choice. Almonds have a good amount of calcium, 76 milligrams of calcium. Dried figs, 1 cup of broccoli. These are all in the 50 to 60 milligram range. Cooked white beans offer 100 milligrams. Salmon, leafy greens, fortified foods, tofu, sardines, almonds, figs, broccoli, white beans, salmon. They all work great. You also want to look at vitamin K2. So vitamin K2 is a newer one. I've made a lot of videos about this. Vitamin K2, there's no specific recommendations. It's different than vitamin K1. It's recommended to get about 120 to 200 micrograms in most studies.
The World Health Organization, FAO, say that people probably only get 5 to 25% of their daily recommended value of vitamin K2. There's 2 types, MK4 and MK7. MK7 lasts a lot longer, and it's found in fermented foods, natto, soy, sauerkraut, cheese. It is also made by GI tract fermentation.
Vitamin K2 is very important to work with vitamin D. Generally, this is found in fermented foods and beans like natto, sausages, different types of meat. But as we eat more processed foods, we're mostly deficient in vitamin K2. Levels are lower than ever, and it stops that calcium from going into the bone.
Vitamin K2, especially MK7, does a few things. It essentially causes gamma carboxylation of glutamic acid residues. And what that does is it activates matrix GLA protein and osteocalcin. These are important in taking calcium and putting it into bone. So essentially, when you're getting proper vitamin K2, your teeth will be stronger, your bones will be stronger. All these things will do a little bit better. You'll have less osteoporosis. At the very least, it reverses the benefits of a deficiency. So that's what the studies show.
I go over the studies exactly what vitamin K2 does. Essentially, vitamin K2 takes that calcium from your blood into the bone, whereas vitamin D puts it into the bloodstream in the first place. So vitamin D gets it into the blood and K2 gets it into the bone. Check out my video on vitamin K2 and all the recommendations and mistakes people are making.
There was also a great researcher called Dr. Weston Price who essentially claimed patients who took a decent amount of vitamin K2 and were not deficient never had cavities. So he said that happened in his career.
And when I say high levels, people are taking between 90 micrograms per day and 360 micrograms per day. Magnesium. Magnesium is another huge one. Magnesium is in the bone, but it's also found in a lot of supplementary pathways. Specifically, the hormones that regulate high or low calcium levels require magnesium. The parathyroid hormone and parathyroid gland needs a high level of magnesium. And then magnesium is important to actually make vitamin D. You can't make vitamin D if you're severely deficient in magnesium. It's important in that pathway. And then it's involved in 600 other enzymes. So very important, 60+% of people are deficient in magnesium. What type of magnesium do you want? I go over a video, all my favorite types of magnesium, but I like magnesium 3 and 8 for brain function. It's a little bit more expensive, but studies are really good. Magnesium chloride, magnesium citrate, and magnesium glycinate, especially if you want to get to sleep well. Glycinate works really well. Check out my magnesium videos. I go over all the studies, all the details below. And then omega-3 fatty acids. While it doesn't directly put the minerals into the bone, a lot of studies show that omega-3 levels, if supplemented, can gradually improve bone strength and quality and work well with vitamin D.
I link my favorite omega-3 supplements down below, but you want to get about 1.1 grams per day for women or 1.6 grams per day for men. EPA, DHA are the way to go. ALA is plant sources. Get at least 50% fish oil. That's the big trick. The side effects are burpee and fish smells. You want to get ones that are cost effective and make sure they're mostly omega-3 fats. Some of the bad quality ones, they're like 90% bad fat and only like 10% fish oil in the capsule.
And I go over a new supplement called Coact. This is a collagen peptide formula combined with calcium that focuses on the fibroblasts that build the collagen in our bone. That's a newer one. It is not as proven as the other ones, but I go over that in a video linked below.
If you look at the composition of bone, about 2/3 of it is ceramic material like calcium and potassium, but the rest is made of organic compounds, mostly collagen. So now what's collagen? Collagen, when you start shrinking down, at first you see the hard bone, but then you see the cells that make up the bone, and then you get down to collagen fibers. These collagen fibers are made up of tropocollagen, and this is the base element that adds the flexibility and the scaffold. This has to be nourished as well to avoid osteoporosis.
And the single most important thing you want to do for your osteoporosis is strength train. You have to load your bones. This is the single most important thing. The British Journal of Medicine did a study within the last couple of years looking at mortality, and this involved bone strength. People who strength train, and this is simple stuff like doing Pilates, wall push-ups, air squats like this. I'm not saying going to lift heavy weights, but even going on walks qualifies as strength training. Anything that loads your joints with body weight. There's something called Wolff's Law.
Wolff's Law states whenever there's more pressure, more compressive force, that bone will develop more strength, more trabeculae, more fibrils to strengthen itself against that force. So the more stress and the more strength training you do, the stronger your bones will be.
Wolff's Law says if you put pressure on a bone, that bone will strengthen. I talked about osteoblasts and osteoclasts. When you put weight on your bones, it stimulates those osteoblasts to work hard, to build new bone, and prevents that breakdown. Strength training is unbelievably important. And that means getting up, moving around. It's that easy. You don't need to do any secret remedies. It's getting enough nutrients to build up those calcium building blocks, that mineral matrix, making sure you get enough collagen in your diet, make sure you get enough protein, supplement with protein as well. That will strengthen your bones. And then you got to load those bones. So whether you're doing cardio or specifically strength training, that will get it better. If that still doesn't do it, check with an endocrinologist, get your DEXA scan, get your quality scanned, and look at specifics. Maybe you have osteoporosis because you're going through menopausal changes. Maybe you have hormonal changes. Maybe you're on steroids. You got to look at all these health conditions. Smoking, alcohol, you got to cut those things out. Correcting those issues will make a big, big difference. And you got to eat a proper diet. The more sugar you eat, the more processed foods you eat, the less of those nutrients you're going to get. So it's very important. Proper natural supplement through diet, proper diet, load those bones, get some cardio in. If that doesn't do it, then get checked out. But that should do it in the vast majority of people. Check out those guides on how to strength train. Me and Coach Ryan do a course, 30 days to turn around your health for people with osteoporosis, health issues that have a hard time moving. Check that out below.